Every disease that I saw in my office over a period of, say, 10 years had a dominant parasite involved. Remember, I was testing everybody for a set of parasites, about 70. I list all the parasites in the book, which ones I was testing for. And to my surprise, if you had diabetes, it would be urethema, the pancreatic fluke. Pancreatic fluke. Diabetes is a disease of the pancreas.
What about the fluke that you talked about, the fasciolopsis fluke? How did we get that into our body?
It's in the meat and the dairy industry, except in kosher foods. We were just discovering that kosher food, and this will go into the book still, that kosher dairy products do not have these parasites, which shows you it's a matter of cleanliness.
We now have all the people watching this squirming at home because they all think now, okay, I understand, I have parasites in my body. And we all do, according to your research.
Yes, of course we do.
So according to your research, you've found that all humans have this, and as long as we're healthy, we're okay with it because the body can handle it. My next question to you is, how do we rid ourselves of these tenacious bacteria, parasites, and virus? Do you have an answer to that?
The answer that I came up with already in the first books was the hull of the black walnut tree, but the hull has to be green. There is something in the green hull that kills everything I ever tested for, which doesn't mean everything, but let's say close to 100 parasite varieties.
So you're telling me that in all of our pharmacology, all the millions of dollars spent with research in cancer, the native Indians who were using this hundreds of years ago already had the solution to cancer?
Those who were, yes, but I don't know how much folklore there is around this herbal product, and there are many other good herbal products out there. I'm sure there must be other things that can do the same thing.
But you found this to be the best product.
Yes, and now we have a freeze-dried product which is even more potent than the alcohol extract that we call a tincture. And apparently freeze-drying preserves some extra elements so that you don't even really need the cloves and the wormwood with it. Now, not enough experiments have been done so that I can say you never need them. But a person can now use a freeze-dried variety and be saved the extra chore of taking so much cloves and wormwood.
I started to be very, very interested in the relationship between parasites and the Candida. So my first thing was I looked into the books from the clinics, books on parasitology, and to my own surprise, when you read books on parasitology, they would say that on some of the parasites, the fungus live on the skin. That is known in the clinic. That is not something new. I read Dr. Clark's book and I see that she says the fungus could live in the parasite. So the thing does not really contradict itself, on the contrary. And that was the explanation, because those people we could not get through with the fungus therapy, they had parasites, and on those parasites they had fungus living. The moment we attacked the parasites with all the the parasites is exactly the moment we got through in the fungus therapy. So from that moment on, I was very, very interested, and I started to read all those books, and then I got all the parasites I could get a hold of. In the meantime, I have more than 90 or 100 parasites. You could see all those. This is a kit I developed, which now in Germany is being very popular. especially in all people working with the BICOM, they test with this kit. There are more than 50 parasites in there, which are all the flukes and all the nematodes, all the cestodes, all the... it is not enough, my experience is that it is not enough just to treat the fluke. The Phaseolopsis busci, you also have to see all the stages, and it is not allowed that any stages would be on any system left, because if it does and the patient got better, but then we saw that sometimes the disease, the cancer can start again, and when it starts again, we found that again the busci has developed. So we have to make sure that everything is out of his system and that the immune system is stabilized.
So we have a relationship with two parasites and cancer, Clostridium bacteria,
Yes.
and the Phaseolopsis parasite, which you call the fluke. How did we
Yes.
get that?
The Phaseolopsis larval parasite belongs to the malignant development. The Clostridium belongs to the pre-malignant or tumor growth part of the whole process. How do we get them? That has been the subject of my research and what's in the Advanced Cancer book, of course. We eat Clostridium bacteria because they're everywhere in dirt, but we don't get sick from eating Clostridium in dirt. We eat a common little parasite in dirt called rabbit fluke. It has a scientific name too. And that rabbit fluke brings in Clostridium, sort of like the Trojan horse brought in soldiers. They are within. So after eating rabbit fluke with nearly all the food that you think is perfectly safe.
Carrots? Root vegetables?
Raw carrots, yes. Even cooked carrots, yes. Because this parasite, the rabbit fluke, does not get killed by boiling temperatures. We test all the food for our patients for 3 molds: zearalenone, patulin, and aflatoxin. I see those molds, that is the mycotoxins that they make, not the mold, growing mold itself. But the mycotoxins they make are dreadfully toxic, and I always see them in cancer patients, right in the tumor. I'm not sure what the significance of that is, but when you find it's a common denominator for tumors, it does make you think it's important.
And where does the patulin mold come from?
Patulin is found in other fruits and plant materials too, but apples is where we get most of it. You can hardly peel an apple without seeing some mold under the peeling, and that will have patulin in it.
Is that what we see in the brown spot?
Yes, that's what the brown spot is. It isn't really a brown spot, it's a moldy spot.
How do you suggest we prepare our fruit, and how should we eat it?
Mostly don't eat it. Peel those fruits. Peel the potatoes, peel the apples, peel the pears, peel the peaches. Peel everything, and then you'll be astounded at what you have been eating.
What's your concern with the relationship with the pet and the sick patient?
Pet dander and pet saliva and pet filth gets into everything in the room. I have tested dust from the room of a home where there was a pet, let's say just a cat, much as I love cats, or a dog, and there are ascaris eggs everywhere and tapeworm eggs everywhere, on the tabletop, on the kitchen counter, on the chairs, anywhere you want to take a dust sample. And why wouldn't there be? Our dander is everywhere, and our germs are everywhere. Why wouldn't theirs be?
And what do these two parasites do to the body?
They are very injurious. Ascaris does some of the most damaging things to us, causes our seizures, causes our very many brain disorders.
About 3 or 4 years ago, I guess it was 4 years ago, Lisa started having seizures. The seizures were, they covered pretty much a wide range of different types of seizures. They covered different areas of her body, which to the doctors basically indicated a non-epileptic seizure. She went through EEG, several different doctors. Anyways, I was referred to Dr. Clark. This is when I actually initially heard of her. And treatment she used for seizures, which was black walnut. We tried her on the black walnut after not wanting her to go on other drugs for negative side effects, and the black walnut worked, so we kept her on that.
And when you start taking the black walnut, did you instantly get results?
About 5 days later, my seizures stopped. I'll have one now at once, maybe every 2 months.
So now you're a clinical dietitian.
Yes, now I work with my husband in his office and we follow Dr. Clark's protocol.
So all the way over here in Italy, you're following Dr. Clark's protocol. Why are you using her specific protocol?
Well, we've used a lot of protocols. My husband is doing orthomolecular medicine here in Italy. He's the president of the International Association for Orthomolecular Medicine here. And we've seen many kind of medicines. He knows Ayurvedic medicine, Tibetan medicine, and vitamins, minerals, amino acids, of course, all those kind of things. Vitamin C from Linus Pauling teachings and everything. And lately we've discovered Dr. Clark's protocol and we've seen that it's very, very effective.
We are helping people to heal by cancer. Yes, we have several people utilizing the principle by Dr. Clark, the black walnut, the vitamin C, the antioxidation, and the alkalinity diet, the alkalizing diet, and we have found very good results. And people, you know, when you increase the level of electron inside the cell, when you stabilize the cell with the proper fatty acids, when you teach the people how to get better, just avoiding the old mistakes, cancer is no more necessary.
What have you seen so far with working with cancer patients and Dr. Clark's formulas?
Great results, great recoveries, and I can say it because I'm not a medical doctor with my husband, as my husband is, so I can be more sincere with you. And because, you know, medical doctors also in Italy, they have to stay aware of the government.
So is there a legal problem with saying that you actually cure cancer?
Yes, of course there is. Yes, you cannot say you cure cancer. He was called by the government once, and they told him, you know, Dr. Pamphili, you're very famous, but you must watch out because you cannot say that you cure cancer. And he said, but I never did. But they told him, but there is some patients of you going around saying they've been cured, they were sick and now they healed, so how is it possible? So he said, they said it, I didn't say it, I mean, that's possible. Okay, but you know, the work of a doctor is more of a writing work, you know, you have to prescribe, you don't have to go on alternative medicine, you don't have to look so far, just, you know, prescribe drugs, don't worry.
For those people that are obviously going to be your critics because you use a very powerful word in your book, in the title to your new book, Cure to All Advanced Stages of Cancer.
Yes.
Perhaps you could elaborate on the word cure and help us to understand why you've chosen such a powerful word.
The word cure is an accurate word. I chose it because it was the correct description of what I was pursuing.